Hi, my name is Raul Vargas. I'm going to talk about tuberculous peritonitis. First, we have the definition. Tuberculous peritonitis is a serious condition. It is especially common in those patients with risk factors such as an incompromised state, chronic kidney disease, or cirrhosis, liver disease. Typically, the spread of the tubercles occurs hematogenously from the pulmonary foci. Most patients have ascites, abdominal swelling, abdominal pain, and other systemic symptoms, such as fever, weight loss, and anemia.
Hello friends, as you all know, tubercle bacilli or mycobacterium tuberculosis mainly affects lung and the result is pulmonary tuberculosis. But there are other types of tuberculosis which are called extrapulmonary tuberculosis, and abdominal tuberculosis is one of them. And this abdominal tuberculosis include tuberculosis of gastrointestinal tract, mesentery, omentum, lymph nodes and solid organ like liver, spleen and pancreas. And this abdominal tuberculosis is actually much common than we think. Friends, today I'll talk on the symptoms of abdominal tuberculosis. Let's start, friends. Friends, abdominal tuberculosis is caused by Mycobacterium tuberculosis and sometimes by atypical mycobacteria. And the symptoms of abdominal tuberculosis are varied, and there are lots of presentation of this abdominal tuberculosis. I'll discuss the commoner things. The most common symptom of abdominal tuberculosis is abdominal pain. Usually the pain is in right lower quadrant. This pain can be diffuse, it can be central, sometime epigastric, sometime in the lower left lower quadrant. And the patient who actually has intestinal obstruction because of tuberculosis can present with cramps and colicky pain. And the pain of abdominal tuberculosis can mimic the pain of duodenal ulcer. Appendix is also affected by tuberculosis. So if there is tubercular appendicitis, the pain can mimic the usual acute appendicitis pain. Next common symptom is diarrhea. 10 to 20% cases patient present with diarrhea. Usually there will be liquid or semi-solid stool, and there increased frequency of stool. Blood and pus also can be found in stool. Actually, the blood and pus usually found in case the patient is having intestinal ulceration. And there can be a typical presentation of alternating diarrhea and constipation. The next symptom is weight loss and anorexia. In all types of tuberculosis, be it pulmonary tuberculosis or extrapulmonary tuberculosis, weight loss and anorexia will be there. But in case of abdominal tuberculosis, what happens is patient usually has lots of abdominal complaints like abdominal distension, pain, diarrhea, constipation, and lots of other abdominal complaints. So because of these, patient there will be adding thing like patient will not take food. So already there is weight loss or anorexia, and this will be adding to it, like patient will have loss of appetite, and there will be features of malnutrition also. And fever, anemia, these symptoms are usually common in any type of tuberculosis. So patient can have fever or malaise, then less hemoglobin or anemia. Few uncommon symptoms are moving lump. Patient might complain of a lump inside the abdomen, and on palpation also we can find lump in the abdomen. Dowy abdomen or soft abdomen on palpation, it is very typical of abdominal tuberculosis, though it is not very common symptom, but it is characteristic, very typical of abdominal tuberculosis. Then you can find ascites, that means fluid inside the abdomen, usually in the peritoneal cavity. Patient can have abdominal guarding or rigidity, and constipation is a rare symptom. So in short, these are the symptoms of abdominal tuberculosis. Friends, that's all for today. Thank you for watching this video.
Now we have applications in medicine. More than 90% of patients with tuberculous peritonitis have ascites at the time of presentation, with a serum ascites albumin gradient of less than 1.1 gram per deciliter in the absence of cirrhosis. In 10% of cases, patients present with a more advanced dry face with a doughy abdomen, which represents a fibroadhesive form of the disease. The absence of signs of chronic liver disease, such as palmar erythema, spider angiomata, and dilated abdominal wall veins, should increase clinical suspicion for TB peritonitis. The most common medications used to treat tuberculosis include isoniazid, rifampin, ethambutol, pyrazinamide. If you have drug-resistant TB, a combination of antibiotics called fluoroquinolones and injectable medication, such as amikacin or carbamazine, are generally used for 20 to 30 months.
What are the three types of ascites? The three types of ascites are exudative ascites, transudative ascites, and chylous ascites. What are the four causes of exudative ascites? The four causes of exudative ascites are TB peritonitis, pancreatitis, ruptured viscera, and tumors, most commonly metastatic to the liver and peritoneal cavity. What are the five causes of transudative ascites? The five causes of transudative ascites are cirrhosis, chronic hepatic congestion Budd-Chiari, constrictive pericarditis, right heart failure, nephrotic syndrome, myxedema, and Meigs syndrome. What are two causes of chylous ascites? The two causes of chylous ascites are thoracic duct or abdominal lymphatic trauma, and mediastinal tumors. FlashMed, video flashcards.
Pros and cons. The pros. Treatment is largely supportive and is aimed at providing multidisciplinary surveillance and symptomatic management of complications. Include an adequate hygienic dietetic regimen according to the clinical characteristics. Laparoscopy with biopsy is a valuable technique for the diagnosis of peritoneal tuberculosis. The cons: rupture of the appendix or the hollow viscera, cirrhosis with decompensated ascites, intestinal obstruction, massive hemorrhage. Issue playing in Ecuador. Use of adenosine deaminase (ADA) as a parameter in the diagnosis of patients with extrapulmonary tuberculosis, pleural, peritoneal, and NCS. The determination of ADA for the diagnosed tuberculosis extrapulmonary, it has a sensibility superior to the 80% with values that go to 45 UL for the pleural liquid and up to 35 UL for the assisted liquid, and finally up to the 6 UL for LCR.
Hello, today we will talk about adenosine deaminase test. What is adenosine deaminase test? Why is it done? How is it done? About this, some basic information I shall give you. What is adenosine deaminase? Adenosine deaminase or ADA is an enzyme which is produced by activated lymphocytes. Certain diseases like tuberculosis activate the lymphocytes and increase the amount of ADA in fluids like peritoneal fluids. What is ADA test? This test measures the amount of ADA or adenosine deaminase in the pleural fluid of the patient. This test may be performed rarely in peritoneal fluid and cerebrospinal fluid also. How is this test done? For this test, a small amount of pleural fluid is withdrawn from the chest of the patient. If the pleural fluid is less, then this may be done with the help of ultrasound also. Is there any special instruction that is given before the test or during the test? Although no special instruction is given before the test, it should be remembered that while the test is being performed, the patient may be asked to strictly avoid moving, coughing, etc. Is this test painful? As the test requires thoracocentesis, a needle is inserted in the chest of the patient, so some pain may be felt by the patient. What levels of ADA may be indicative of TB? If the levels are more than 100 international units per liter, then it may indicate that the patient has tuberculosis. Is this single test enough for diagnosis of TB? This single test is not at all sufficient for diagnosis of TB. Usually, other tests like smear examination and culture are required along with radiological examinations. Are there any other causes of increase in ADA in pleural fluid apart from tuberculosis? There are certain other diseases like lymphoma, sarcoidosis or lupus in which ADA may increase without tuberculosis. What are the symptoms which may indicate that the patient has tuberculosis? If the patient has a fever of long duration with no apparent cause, with or without cough of long duration which may or may not result in sputum and blood. Other classical symptoms of this disease include loss of appetite, night sweats and weight loss, etc.
Conclusions. Peritoneal TB occurs most commonly following reactivation of latent tuberculous foci in the peritoneum established via hematogenous spread from a primary lung focus. Diagnosing this condition is difficult, but we can do it by an assisted fluid analysis with SAAG calculation, microbiological tests, mycobacterial culture growth, peritoneal biopsy, laparoscopy, or mini laparoscopy. Thank you for your attention.